Welcome to Conversations with Crosswinds Counseling. I'm your host, Cutis Smith. Every week on this podcast, we talk about all things mental health, sometimes stress or anxiety. Perhaps you're burned out. Well, this is the podcast for you. We sit down with the wonderful counselors at Crosswinds Counseling and have a great conversation every week. Let's dive into this week's episode. Hi, everyone. I'm Cutis Smith. Welcome to Conversations with Crosswinds Counseling. This week on the podcast, we are joined by Shaun Hardie, one of the counselors here at Crosswinds Counseling. Shaun, thank you so much for being with us.
It's great to be here. Thanks for the invitation.
Of course. We are talking today about something we've never talked about on the podcast, and we've covered a lot of topics now for the last couple of years. It's acceptance and commitment therapy, or ACT. As I've said 1,000 times on this podcast, I am not a counselor. And so, Shaun, I don't know what that is. What is acceptance and commitment therapy?
Well, acceptance and commitment therapy is a cognitive behavioral therapy approach. They call it a third wave approach. And so it incorporates mindfulness into what is a traditional CBT approach. But it does have some differences. And so there's just some things that I wanted to bring up today.
Yeah, tell us that. I think mindfulness has become one of those kind of buzzwords the last couple of years. I think maybe around COVID, it became more of a hot topic. I think a lot of us understand mindfulness, but maybe give us a quick overview of what that even is for someone who doesn't know.
Sure. So sometimes I like to understand words by their opposites. So if anybody has experienced mindlessness, that kind of helps us kind of get some reference for what mindfulness is. Mindlessness is just that distractions that we tend to get overwhelmed with, and we can kind of just not really find our way and kind of just be living in our head a little bit. And so after a long day of work, sometimes we veg out, maybe watch a Netflix show, listen to some music, and we're there, but we're not really there. So that's mindlessness. Mindfulness is really tuning into the present moment, really putting our attention where it is on the here and now. Yeah. And so whether that's playing with your kids, wrestling, like my 4-year-old daughter really likes to wrestle. Actually, all my kids like to wrestle, but she's ready to take me down. And so mindfulness can be even in that present moment of just being all the way there. But when you hear the word mindfulness, sometimes we get the kind of that Eastern philosophy or religious practices like yoga and those sorts of things. And while it does have some associations with that, the scientific approach is really that observing self, of just observing your experience, kind of letting it pass by, having thoughts but not necessarily being your thoughts, having feelings but not necessarily being your feelings, and kind of just tuning into the present moment like around you. It doesn't have to be a religious experience. It can be as a kind of a change the way that you experience your everyday experience.
Okay. So you said that's part of what makes this different. Tell us more about ACT, acceptance and commitment therapy. What else goes into it?
Yeah, so acceptance and commitment therapy kind of has two big parts. There's the acceptance work of accepting your experience as it is, not trying to change it or control it, but allowing it. And for a lot of people, that is just the opposite of what they're doing. In fact, if you look at anxiety, for example, a big part of anxiety is experiential avoidance. So avoiding the experience of something that might be disastrous. And that often makes their life very small. And so acceptance opens it up. If you could view it kind of like a door, the door to your experience when you're full of anxiety and you're trying to control things is closed. Acceptance opens that door so you can at least allow the full experience to be there. And for a lot of people, that just sounds daunting, and that's something that acceptance and commitment therapy kind of helps them with. The commitment part comes into actually what we're doing with our bodies, like acting toward our values. So even though we might have an experience that is terrible, like anxiety, it doesn't mean we stop living our life. And so for a lot of people who have that smaller life experience, it can open it up and they can experience something bigger even in the presence of anxiety. I hope I'm explaining it right, but there's a lot to it.
I'm sure you are. Because this is my first taste of it, I'm trying to track with you. Is this something that can be used with all clients in all circumstances, or do you find it kind of has a niche target audience?
Yeah, so ACT has a lot of research, it's an evidence-based therapy, so it can be used with a variety of mental health conditions. I think the ones that it does very well with are anxiety and depression, but it's also shown effectiveness for eating disorders and a variety of kind of those niche specialties that therapists might use. So I don't use it with every client, even though it may have applications. I find it is helpful for clients who are stuck in life or maybe just so full of distractions, feeling overwhelmed, and those that are using what I call control strategies. So they're trying things in hopes that it'll alleviate their suffering, and it's just not working. So I find acceptance and commitment therapy kind of helps those clients to have a different experience and start living their values.
Yeah, it feels like kind of the beginning point here is you're not accepting what's going on in your life or your circumstances, and you're trying to do a lot of avoidance. So anything that kind of falls under that umbrella, it sounds like is maybe a good starting point to consider this.
Yeah. And this is an experiential therapy, by the way. So it's something you learn as you experience. So it's not just your head knowledge of reading a book or a concept and then you just kind of get it. It's one of those things where we use a lot of metaphors, a lot of exercises so that you can actually experience the acceptance, experience the present moment, and kind of helps people with that.
Yeah, tell me more about that. So you experience it. Is it trial and error, or you just have to do it so that you can trust, oh, okay, here's how I can get through this?
Yeah, well, would you let me kind of just do one of the metaphors?
Sure.
And we can kind of see what it's like. All right, so one of the common metaphors that I might start with is one on quicksand.
Okay.
I don't know if you've ever experienced quicksand.
I've not personally. I've seen it in TV shows or movies, but I've never stepped in quicksand.
Well, if you want to do a YouTube search after this video, you can look up Bear Grylls, the survival guy. He does how to get out of quicksand. It's a really, really good one. Okay. So that's a sidebar. But if you've ever, or if you know what the idea of coming across quicksand is once you're in it, when you struggle against it or you try to get out, it actually makes you go deeper into it. You get more stuck. And that experience is a lot like with anxiety and depression. The more you struggle against it, the more you're fighting against it, the more you're trying to get out of it. It seems like by experience, we tend to fall deeper into it and get more stuck.
Interesting.
And so with quicksand, it doesn't completely get you all the way underneath. You kind of just come to this place where you can't really move and you just get stuck, and you're hoping that somebody else, gets you out. And with quicksand itself isn't going to kill you, but it's the sun. It's staying out, not able to get out. That's what eventually dries you up and you get you die. So with that, the way to get out of it is kind of counterintuitive. And I'm not sure if you know how to get out of quicksand.
I literally that was my next question. So how do you get out of quicksand? Because I haven't seen the video. I've never been in quicksand. What do you do?
Right. So when you get into quicksand, if you ever come across it, you'll start to notice that you're getting to your knees and you're starting to get to your waist. So in that moment, stop what you're doing, and to get out, you actually lay down. You get your body into a flattened position because it doesn't sink. You get more surface area, the harder it is for it to bring you under. And once you've gotten to a flattened position, you can either roll out or you can start to army crawl out of it. And so with life, and acceptance and commitment therapy shows us this, it's a counterintuitive approach.
Yeah.
The more accepting you are, the more willing you are to have that experience, that actually helps you get out of it.
So in a sense, you're saying, okay, I'm in quicksand. I should lay down and enjoy it. Maybe not enjoy it, but I should lay down and accept it and understand it and embrace it and get out of it.
So one of the misconceptions about acceptance is that it's maybe giving up or just surrendering to life, almost like a helplessness.
Right.
But really, acceptance is just accepting reality as it is. We can't change it. We can't control it directly, but it is what it is. And so it's kind of having that, it's there. This is what I'm experiencing. This is how I'm feeling. These are the thoughts that I'm having, and allowing it. And once you're able to do that, it gives you the flexibility to get out. And the aim of ACT is psychological flexibility. It's basically having an option. A lot of people don't feel like they have an option. They just feel like they're rigidly controlled by their anxiety and depression. And so this helps people get that flexibility so that they can make some different choices and perhaps have different outcomes when it comes to their experience.
Fascinating stuff. I'm absolutely going to Google how to get out of quicksand today. I want to see this in practice. I got to see this video. Shaun, is there, as we wrap up here, is there anything else you want to share about this type of therapy?
Yeah, if you're interested in acceptance and commitment therapy, I have a YouTube channel that I started over a year ago with just over 1,000 subscribers on learning acceptance and commitment therapy. So it's for therapists, grad students, and for really anybody that's heard of acceptance and commitment therapy or open to it. And so I have a lot of videos there, so you're welcome to check those out.
Awesome. And of course, you can check this podcast out every Tuesday. Shaun, thank you so much for being with us today on Conversations with Crosswinds Counseling. Really appreciate diving into a new topic for me. And thank you for joining us as well. As I said, every Tuesday we've got a new edition of the podcast coming out, so we'll see you next week. Have a good day. Thanks for watching Conversations with Crosswinds Counseling today. Don't forget to like and subscribe to get more of our podcast. And you can comment in the section below. Perhaps you could share what you'd like us to discuss in future episodes. We've got new episodes coming out every week. So we'll see you next time on Conversations with Crosswinds Counseling.